This article is a review of the clinical trials for Gabapentin enacarbil in the treatment of moderate to severe primary restless leg syndrome. Restless leg syndrome, or Willis-Ekbom disease, is a sleep-related movement disorder. The four essential criteria used for the diagnosis are an urge to move the legs with or without abnormal sensations, worsening of symptoms at rest, improvement in symptoms with activity, and worsening of symptoms in the evening or night. Additional clinical features include positive family history, normal findings on the neurological examination, periodic limb movements during sleep or wakefulness, which can be found by the polysomnography or the suggested immobilization test, and a positive response to dopaminergic agents. The disease severity or drug response is evaluated using the International Restless Leg Syndrome Study Group Rating Scale. Restless leg syndrome should be treated when symptoms impair quality of life, daytime or social functioning, or sleep. Dopamine agonists are generally considered first-line agents for treatment of moderate to severe restless leg syndrome. However, the adverse effects of dopamine agonists, such as augmentation, often limit their use. Other medications used include benzodiazepines, opioids, and anticonvulsants, such as gabapentin. Gabapentin is a GABA analog widely used in the treatment of seizures and pain syndrome. Gabapentin has been also used for restless leg syndrome. Unfortunately, gabapentin has an unfavorable pharmacokinetic profile that limits its use in clinical practice. To overcome the pharmacokinetic limitations of gabapentin, the prodrug formulation, gabapentin enacarbil, has been developed. Currently, the United States and Japan have approved gabapentin enacarbil. The purpose of this article is to review past clinical trials and discuss risks and benefits of gabapentin enacarbil treatment for restless leg syndrome. Here, I have two clinical questions on this issue. The first question is, which maintenance dose is more appropriate, 600 mg or 1200 mg? The second question is whether or not the potential risk for pancreatic cancer outweighs the clinical benefits in patients with moderate to severe restless leg syndrome. The second question is partly related to a conclusion of the first question. I tried to answer those questions through this paper. I hope you enjoy this article. Thank you for your attention.